Male facelifts are just the same as female facelifts, and that's a myth. My name is Dr. Karan Chopra, board-certified facelift neck-lift expert, and I want to talk to you a little bit more about the differences between male and female facelifts. There's a couple notable differences that we have to pay attention to when dealing with the male facelift patient. Number one, beard and hairline shift. Number two, higher blood pressure, greater tendency for hematomas. And the third is respecting the masculinity versus the femininity of the case. So in males, the patients do have beards. So if we're going to use a retrotragal incision, let me show you that here. I'll show that on the screen. This is a retrotragal incision versus a pretragal incision. The difference is that in men, we like to make the incision in front of that structure called the tragus, so we're not bringing that bearded skin onto the tragus. So take a look at this picture of Jose, one of my famous patients who's gone viral on Reddit. You can see that when he's healed up, he's got a beautiful invisible scar hidden in the beard, and there's no distortion of his actual ear structure itself. The second issue in male facelifts is the slightly increased risk of hematoma. Whereas in a female patient, the rate of a hematoma, which is also known as a small collection of blood, is about 1 to 3%, whereas in men, it can be as high as 8 or 9%. And the difference of that is attributed to a couple different things, mainly the presence of a beard. Bearded skin tends to have a greater vascularity, meaning blood supply, and is at a greater risk for bleeding. And the second is sometimes male patients can have a higher rate of high blood pressure, so we really want to be on top of that with clonidine, either orally or with a topical patch, and it just keeps a nice, even blood pressure without bottoming you out. And the final difference that I take into account is respecting the masculinity, meaning I really want to define out the Adam's apple, the jawline, but I'm not going to be over pulled in the face, and I want to keep a natural. In men, we want to go for improvement, not perfection, because chasing that perfection could cause some feminizing looks in the face that patients may find objectionable. So anyway, I hope you found that helpful. If you have any questions, please feel free to comment or DM, and definitely go ahead and give me a like and share the post with some of your friends. Thanks.